Hey guys, Ashley with Amare. So few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye.
Guys, it's Ashley with Amare. Hello. So today we're going to talk about HS. So Hidradenitis Suppurativa. I have an article from the National Library of Medicine, as always, my favorite place, and we're going to talk about it. So it's commonly referred to as HS. It's a skin condition. They say it's an autoimmune. It is an autoimmune, right? So what is HS? HS is basically like it's reverse acne. So acne comes out of your skin. This is where acne is under your skin. It's these really big lesions. And the reason we're talking about this today is because manual lymphatic drainage helps get rid of HS. So it doesn't turn it off completely, but it helps managing the symptoms, getting them down, getting those big painful nodules to shrink and flatten out so it's no longer painful, getting the wounds to heal, getting the skin to heal. And I'll show you guys pictures of that in a second. But a lot of people suffer from HS. So for those of you who don't know, I want you to picture like an ingrown hair. How an ingrown hair like bubbles up and gets really hard, and it can sometimes become infected in there. HS is like an extreme version of ingrown hairs. It is clogged pores, but the pores are more swollen than anything else. The skin starts to crack open, and something called lymphorrhea starts to happen, which is where you get drainage or leaking, which is basically lymph that is leaking out of the tissue. I am going to post something next week regarding HS, like a little post about it so you guys can see what it looks like and all of that. But I know you guys know me for plastic surgery recovery, but manual lymphatic drainage is used for everything. At Amare, we are a holistic clinic and plastic surgery recovery center. We do both. So yes, manual lymphatic drainage is commonly used for plastic surgery swelling, but it's all swelling. I treat HS all the time, and I realized I'd never done a video on it. Other things that I help with are ulcerative colitis, IBS, DVTs, not DVTs, what am I saying? The other one, IBS, and there's another one. I'm forgetting the name of it, but it's another like bowel autoimmune issue. Crohn's is one of them. I do a lot of the autoimmune. So fibromyalgia, MS, Lyme, all of those. I do a lot of the gut ones and skin ones because it's all related to your lymphatics. It's all inflammation. So any condition that comes with chronic inflammation or is because of chronic inflammation, I help heal, treat, get rid of, manage, all of that stuff. So my clients will come to see me, we'll do a clean out, we'll figure out their triggers, and then from there, they're managing on their own. You guys don't need me anymore. You shouldn't need me. My job is to teach you about these conditions and how they're related lymphatically and how to keep them under control. So one of the things that I do a lot is HS. So let's start getting into this. So Hidradenitis Suppurativa, fancy name, also called acne inversus. So reverse acne, like acne under the skin, is a chronic inflammatory skin condition with lesions including deep-seated nodules and abscessed draining tracts and fibrotic scars. Interesting. So, in all the things that I do, common theme related to the lymphatic system. And this article actually does mention the lymphatic system in relation to HS, which most people don't understand. If you have HS, you know how painful it can be. It usually results in the armpits, in the groin area, the gluteal region, the inframammary fold underneath the breasts, anywhere that skin rubs against each other, as they say, or anywhere that you have lymphatic pathways, which I'm going to teach you guys about in this video. So it's a chronic inflammatory skin condition with lesions. And again, I say it all the time, anywhere you have swelling, you have a potential for fibrosis. And I mention this a lot in my fibrosis videos. So with HS, fibrosis, fibrotic scar tissue, is the same thing. It's that thick fluid that starts to build up and make that hardness under the skin. So these lesions most commonly occur, then it tells you what I just said, in interregionous areas and areas rich in apocrine glands. So just think glands, right? So armpits, your hip creases, inguinal lymph nodes, anywhere that you have think about sweat glands, right? Among the most common are the axillary, the groin, the perineal, so the whole reproductive area down there, the inframammary and inframammary locations. Because of the associated pain sensitive locations, drainage, odor, and scarring, this condition may have negative psychological impacts. And it does, guys. I'm going to show you a picture of how bad it can get and what it looks like. And when I tell you, because these are areas that are normally meant to secrete sweat or moisture, things like that, bacteria does start to build up. Odor starts to build up. And when part of that odor that you get with HS coming out of the wound is the lymph underneath, the swelling, right? Lymph underneath that has been sitting stagnant for so long under the skin, just sitting there like a swamp. And now it's starting to break through the tissue and all of that swamp water is coming through. That's basically what it's like. So let me show you guys a picture. So this is what HS looks like. It starts as these bumps, right? What we'd think would be like razor burn or an ingrown hair, and then it progresses and the skin starts to break, and then it turns into this. That's a very, very common form that I see. I usually see patients and clients when they come to me at this stage of HS. Sorry guys, I know it's shaking a lot. So HS can be something that's, minimal like we saw, or very, very far along in those stages where it does get to be pretty bad. And this, again, think about it like reverse acne. This is not just your standard pimple, guys. This is where the skin is breaking open. And like I said, if you have HS, you know how painful and how impactful it can be as far as the odor, not being able to wear deodorant. This is not something that happens just because you sweat a lot in those areas. This is something that happens a lot of times because of genetics. And it does come with a swelling lymphatic component because of those genetics, which is what makes it a lot worse, is because no one's dealing with the lymphatics of it, which is why I'm doing this video. A lot of times you'll go to the primary care physician, and then they'll send you to a dermatologist. And the dermatologist will want to use steroid creams, cortisone shots, antibiotics, obviously. That's definitely a must because, again, that bacteria that's building up under the skin there, because of the stagnated lymphatic fluid, because of that stagnated swelling and the breaking out of the skin and the lesions, that is something that is very important, is making sure that we're taking those antibiotics. Let's see. Okay. This is just saying the same thing. Okay. So, HS appears to have a genetic, environmental, and behavioral influence. 33 to 40% of individuals with HS report the affected first-degree relative, suggesting a hereditary component with an autosomal dominant transition pattern. So yes, there's a pattern, but it can come from either side of the family. It is a lot of times genetic. It is an autoimmune disease. So when they say environmental and behavioral influences, here's how it works with autoimmunes. It's like a light switch, right? With genes, with any gene. It's like a light switch, and that light switch has a dimmer on it, right? Let's say when you hit puberty, and this is when it most commonly in women shows up, is either puberty, after pregnancy, or when we hit menopause. Anytime there's like a big hormone flux, right? So there's a dimmer switch, and you have an event such as puberty or some sort of chronic sickness where your body and your immune system really takes a dive, and that light switch gets turned on. it only has a dimmer switch now. There's no more off button. There's only a dimmer switch. It's been turned on, it's been activated. So now either that dimmer switch is all the way up where the symptoms are very, very prevalent and very high, or we bring it all the way down to where you barely even notice it, where it's barely even a thing. So that's kind of what they're saying as far as environmental and behavioral influences, is that a lot of times the environment you're in, as far as the stress, the things that you're eating, how much you're sleeping, how you're taking care of yourself, right? Your immune system or your lymphatic system, and then behavioral influences. So along the same lines. In a small subset of affected families, researchers have identified a mutation of the gamma secretion notch signaling pathway. So all that fanciness to say that they have actually found and identified mutations of certain genes. Environmental and behavioral factors also contribute. Individuals with HS are more commonly overweight or obese. So like I said, lifestyle things. Obesity leads to greater interreginous surfaces of the area and skin friction, increased sweat production and retention, and hormonal changes, like I just said, leading to relative excess and all associated with HS. So metabolic syndrome is most common in obese individuals. All right, we don't need to read all that. And then it goes on to say how smoking, like nicotine, makes HS worse because it clogs the pores. Influences of hormones can be seen in HS. There is a great prevalence in females than males, greater prevalence in females than males, with the age of primary occurrence most commonly between puberty and menopause. Exactly what I just said. So in addition, there are fluctuations of acute symptomatic episodes and severity with menstrual cycles and exogenous hormones. So again, like I said in the beginning, guys, there is a hormonal component to this, right? There is a genetic component to this. Why? Because with our hormones, when our hormones flux, we swell. And that happens so that we can either shed the lining because we're not having a baby, or produce that fluid to have a baby. So our hormones play a big part in all of these autoimmune conditions, especially with HS, because it's right beneath the skin. So think about how you get really bloated around your cycle. And if you have HS and those really big nodules, they will inflate because they're right underneath your skin and they are exactly at the lymph sites. So let me show you guys this. You know, I love this map. I love this map. These pathways are generally where you'll see HS show up in these pathways. In between here, up here. Oh, hold on. Let me do this so I can see. So the armpit region here, across the chest, you'll have those nodules and those pimples. Down the sides a lot of times. In the chest right here in this pathway. Down here in the inguinal region, right across the pubic region. And then, oh, I love how I flipped this over. I went to say back, but the back is right here on the back. So the back across here a lot of times, and in the chaps region under here by the gluteal fold and across the upper back. This is also back knee. People who get back knee generally get it in this region right here. That's generally where it starts, and then it spreads from there because that's your lymphatic pathway. So let me take a pause real quick and explain to you guys how this relates to the lymph system. So for those of you that don't know, the lymphatic system is your body's way of getting rid of debris, excess water, excess fluid, and waste out of your body. The reason your skin stays clear all the time is because of your lymphatic system. The reason that you are not walking around swollen, puffy, and bloated 24/7 is because your lymphatic system, which is only a hair thick and a hair deep and runs just beneath your skin, as you saw on that map, all over every single piece of skin in your body, is a tiny little hair thin lymphatic vessel that's constantly moving fluid out of your body back into your veins, back into your bloodstream, and then you pee it out. You're doing this every day, all the time, 24/7. With something like HS, that's not happening. And it's not happening at the lymph node sites themselves. So the lymph nodes are either too congested or not functioning properly, and none of that fluid is getting filtered out, and it's bubbling up and building up under the skin, and it's creating those giant nodules. And then because there's so much pressure and it is an area where all the fluid is trying to get to, it winds up busting open and causing that lymphorrhea or that drainage. So hormones influence this. We talked a little bit about that, right? Obesity. Now here's my thing with that. And it does talk about this in this article. A lot of times you'll get misdiagnosed with HS, like all the time. And then you guys find me and it's like really bad. But then we get rid of it and it's fine. Or we calm it down, I should say, and it's fine. But misdiagnosis for HS is extremely common. Doctors will say it's an ingrown hair. You'll go to the dermatologist and they'll tell you, oh, you just need to exfoliate. Or, oh, it's just ingrown hairs that you're having. Use this, peroxide wash. There are not really a lot of people that specialize in HS the way that I do, because I know it's so intricately with the lymphatic system. The doctors really don't know. They don't know how it happens. They don't know how swelling works. They don't know why this whole thing is draining. They don't know any of it. And it does talk about in here somewhere how commonly misdiagnosed HS is. I've had dermatologists tell my clients everything from you're not washing your body right to it's your razor to you should try and get waxing done instead to it's an ingrown hair. And I mean, these things are big, guys. You saw the pictures. It's a lot, and it can cause some really bad scarring and hyperpigmentation. It's not just a pimple. That's not what this is. It's like a major severe breakout everywhere that no matter what you do will not go away. But with that being said, with obesity, a lot of times doctors will just say, oh, you just gained too much weight, it's obesity. But it's not. It looks more like lymphedema. It looks more like swelling, where this half of your arm will be skinny and all of this will be huge. And under here will be huge and breaking out skin and giant folds of skin. And like you saw in that picture, cuts and lesions and all kinds of stuff. That's not obesity, that's swelling. And one of the ways that we tell is basically where the HS is and where the breakouts are, distally to that, away from that. Whatever's closest to that will be a lot bigger than whatever's farther from that. It's localized edema. It's a lot, and it's in that area because nothing can get into those lymph nodes because they're blocked or they're clogged or whatever the case may be, and it's backing up into any of the surrounding area that it can fill. So the chest wall, the arm, in the groin, it's the thighs. The top of your thighs will look really big and like jello-y or squishy. It won't look like evenly distributed fat. And again, doctors will tell you, oh, well, sometimes you just gain fat in other areas, more areas than others. Yes, but this is extreme. This looks really big. And it's in conjunction with what's going on under here. This is also really big. So the obesity thing, it's hard with these medical journals to tell because a lot of times they're not looking at all of the factors. Sometimes that is not obesity and it is just swelling. So that's my little tidbit on that. So estimated prevalence range from under 1% to 4%. These numbers are likely underestimated because of the underreporting and misdiagnosis. The onset of the condition is commonly between puberty and age 40, most frequently from 21 to 29. Women are more commonly infected than men in approximate ratio of 3 to 1. There is lack of evidence, blah, 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 to show patterning of ethnic, blah, blah, blah. Okay. So, alrighty. So, pathophysiology, which just means like explaining the thing itself. The pathological process of HS begins when a defective hair follicle becomes occluded, which means blocked, and ruptures, spilling its contents. So all of that fluid that was in there, think about like a cyst that ruptures, right? Including keratin and bacteria. So let's pause there for 1 second. Your lymphatic system is responsible for carrying proteins, keratin, white blood cells, fats, bacteria, and water. All of that fluid that they're talking about spilling its contents, that's all lymphatic fluid that your lymph system is supposed to be picking up and dumping back into your blood 24/7. And for whatever reason, genetics, or like they say it begins with a defective hair follicle, that's not always the case. It doesn't always begin like that. Sometimes it just starts breaking out. And a lot of times it's like a hormonal change that causes that. And you start breaking out because you're swelling in that area and your lymph isn't functioning, and all of the contents break out of the skin into the surrounding skin, dermis. Yeah, okay, sorry. I'm not going to read all the fancy words, guys. I'm just going to sum it up for you because it's going to take too long. An inflammatory response by surrounding neutrophils and lymphocytes can lead to abscess formation and subsequent destruction of the adjacent structures, the skin. So what it's saying is the inflammatory response that keeps happening to cause this autoimmune, because it is a chronic inflammation issue, and the lymphocytes that are in there lead to the abscess formation. So basically, the process of HS, they say it starts with a follicle. It doesn't always have to, but for whatever reason, your body is having a lymphatic breakout reaction. And when you have bacteria in your body that is not being processed, the white blood cell part of your swelling, the lymphocytes, are meant to neutralize that and move it through these tiny hair-like lymph vessel structures into the lymph nodes. The lymph nodes then filter all of that out, process it through your body, and dump it back into your blood. What they're saying is that's not happening. So, other abnormalities immune-wise have been observed. Elevated levels of inflammatory cytokines, including tumor necrosis factor, and various interleukins have been detected in lesions of HS and possibly provide targets for emerging treatment. Okay. Bacteria does not appear to be causative. So causative meaning bacteria is not the cause of this. It is a lymphatic problem. So aspiration from an unruptured lesion typically yields a sterile culture. So again, it's sterile. It's just lymph fluid that's sitting under there. It's not a bacterial infection. However, as it says, bacterial infection and colonization during the process can secondarily worsen HS. So the bacteria doesn't really start until it starts breaking open and leaking and all of that stuff. The stuff that's causing the HS, that's causing the lesions, is built up lymphatic fluid. And that's what they're saying. When they do aspiration and they take a syringe and drain that thing and suck the fluid out of it, that fluid is just lymphatic fluid. There's no virus, there's no bacteria, there's nothing in there. It's sterile. But the bacterial infection comes from that area being wet with the lymphoria, the leaking lymph, the leaking fluid, right? That lymph fluid that's stuck under the skin that finally breaks out from pressure. That's when the bacteria starts to colonize and become a problem. So we're not going to read the whole history of this. We're just going to skip to the important parts. So because the early stages of HS are often mistaken for other conditions, the average delay in correct diagnosis is 7 years. It can be way longer than that, guys, way longer. Clinical diagnosis requires recognition of morphology: deep, inflamed, painful nodules, sinus tract, scars, the location, the armpits, the hips, those areas, and the chronicity of the disease process. So like how chronic it is, how long it's been, periods of activity and remission, things like that. So up to half of the individuals reported with this syndrome involving burning, stinging, pain, warmth, or hyperhidrosis, which just means like that skin bubbling in that area 12 to 48 hours before the appearance of a lesion. Triggers can include menstruation, weight gain, stress, hormonal changes, excessive heat, and perspiration. On presentation, individuals are typically well appearing unless secondary infection or advanced disease is present. So well appearing meaning like the first and second picture that you saw. The third picture is pretty serious. That's generally when it's been there for a while. I'm talking years. So characteristics of primary lesions are deep-seated nodules, usually 0.5 to 2 centimeters, that last from days to months. They are often mistaken for boils. Yeah, they're often mistaken for boils. However, while boils will respond rapidly to drainage or antibiotics, the nodules of HS are deep and can rupture and track subcutaneously. Why is that? So a boil is on the skin. These nodules are under. Why is that? Because it's a lymphatic problem. Think about where your lymph system is. It's a hair deep under your skin. These are not pimples. They're giant built up nodules under the skin of lymph fluid. In advanced stages, thick fibrotic scars and plaque can develop, leading to architectural distortion of the area. architectural. The words they use sometimes, guys. No wonder you guys can't read these things. So here's how it starts. Let me just paint the picture since we're going over this, right? You get like tingling, burning, itchiness, weirdness going on. And then all of a sudden, boom, you have a little nodule within that 12 to 48, 72 hours. You have a little nodule and it grows and it grows and it grows. And every time you have your period, it grows more. And you're like, what in the living bejesus? And it's like now been a couple months, like several months. And you're like, okay, this thing has shrunk and gotten better. You've gone to the doctor. If they've said, oh, it'll go down, it's ingrown hair, whatever they say, right? Put heat on it, all these things that you shouldn't be doing. And then you leave it and it starts to get hard. Why? Because that swelling, that fluid that's in there, and this goes for anything that has swelling that sits stagnant for a very long time, that swelling in that fluid is becoming fibrotic, which means the proteins, right? The keratins, the plaque, the fibrinogens, myofibrins, elastins, collagens, all the things that float around in your intracellular mixture, your fluid, your interstitial fluid, all of that stuff that normally your lymphatic system, those macromolecules, is picking up and you're peeing out on a daily basis isn't happening. So it sits in there and it starts to get hard and congeal and thick and become fibrotic. We can reverse that with manual lymphatic drainage. We can soften that, we can get them down, and we can get you to start peeing out those proteins again. Okay. So the axilla is the most common location, axilla, armpit, is the most common location for HS lesions. Other common areas are the inner thighs, the inguinals, so like the hip crease, under here, the buttocks, the pubic area, the scrotum, the vulva, the trunk, and less commonly the scalp and retroauricular behind the ears area. I have seen it back here because of the glands. Guys, think about what they're talking about. So underneath the sweat glands in the entire reproductive area, you have tons of glands there, man and woman. You have glands here, you've got glands in your hip crease, you got glands in your breasts under here, you've got glands behind your ears, you've got glands, believe it or not, on your scalp. That's how your scalp stays hydrated and healthy, right? So this is a gland problem. It's a secretion problem, it's a fluid problem, it is a lymphatic issue. Pertinent history includes onset from puberty into young adulthood and history of recurrent lesions with intermittent improvement or resolution. HS is a chronic condition. Identifying family history of similar conditions is also helpful in establishing a diagnosis. It does a lot of times run in the family, like a lot of times. A lot of people will just say, oh, we just have thick hair or prone to ingrown hairs. It's a lymphatic problem. You shouldn't be prone to ingrown hairs. That shouldn't be a thing. Yes, your hair can be thick and curly or kinky and coarse and all of those things, but it shouldn't be building up and getting stuck under your skin. If it is, there is an issue. We have an issue. So let's skip the evaluation part. This is important. However, a biopsy is beneficial to rule out cell carcinoma in the presence of severe HS if the diagnosis is uncertain. If you don't know that there's a family history of it. Bacterial cultures are not beneficial unless a secondary infection or alternative diagnosis is suspected. So a lot of times they won't check. Unless there is a really bad odor and we know there's a bacteria, they won't do like a culture swab or anything like that. Unless, like they said, there's a secondary infection on the outside. These lesions may warrant further imaging, including an MRI. Sometimes they can be taken off with surgery if and only if you have the HS under control and the lesions don't go away. Surgery is not always required. Guys, this is a swelling issue. Your skin is bubbling up from underneath because nothing's processing. You may be in remission for it, right? Let's say you change your diet. Let's say you are eating healthier, you're working out, your hormones, you figured out there was a problem with your hormones and you're on some sort of hormone replacement therapy. Everything's under control and you still have this. It's because your lymph system isn't moving. Just because you fix the problem doesn't mean you've cleaned out the area. Manual lymphatic drainage gets your body to open up, dilate, and suck all that stuff back so you can pee it out. And it works immediately. There is no downtime. We don't have to wait 4 or 5 days. It's literally directly on top of the lymph nodes. It clears out really, really, really quick. When I'm working with someone that has HS really bad, it is literally within the hour. that this stuff goes down, because it's directly over the lymphatic site. So the minute I start working on those lymph nodes and start moving that skin very gently, and we're not touching the lesions. So if we have lesions in here, we're working over here to get the skin here to move. So we're doing this over here. We're not working on the painful site. We're not touching or poking or prodding. We're working the skin around it to get those vessels to dilate and start sucking the fluid back from that area into those axillary lymph nodes so you can pee them out. Okay, treatment and management. Overall goals include treating existing lesions to minimize pain and damage, decreasing the frequency of occurrence, and preventing disease progression. Since limited studies compare treatment regimens, most treatment algorithms are based on expert opinion and consensus. This is me telling you I have experience. And hopefully I will get some progress pictures from some of my clients for HS if they allow me to post them, because I was asked before I do, so that you guys can see how it reverses itself kind of, or how it cleans itself out with manual lymphatic drainage. So in early uncomplicated diseases, topical antibiotics are the first line of treatment. Yes, we want to make sure there's no infection. Topical clindamycin has been the most effective, so topical antibiotic treatments, ointments, things like that. Sometimes those don't work. Corticosteroids can reduce local inflammation, and partial deroofing, punch debridement of individual lesions, can facilitate healing. So deroofing is where they like pull the top of that skin off or do some sort of like minor surgery to kind of let all of that stuff come out and drain. But we don't need to do that because the body has a system of draining itself. That's how we got into this mess, is that system's broken. So let's say we do that and we deroof or we punch debride. We're still not fixing the clogged toilet. We're just scooping the water out from off the top and cleaning the water out from off the top. And we may put new fresh water in the bowl and it may look nice, but it's still clogged. It's not gonna drain. So we may wind up with the same situation, if not a worse situation, where the rest of your body is blowing up because you haven't treated the lymphatic issue of the reason this isn't draining to begin with. So those things are helpful in certain cases, but it's still not going to fix the root of the problem. They talk more about antibiotics. Hormone therapy can be helpful. Oral retinoids, things like that, like all kinds of medication, right? Systemic steroids are effective for some individuals. All of these different things. Okay, so surgery is often needed at the stage that involves wide excision to include the lesions, tracts, and scars of the entire affected area. A combination of medical treatments and surgery excision is often the preferred approach. Other therapeutic options may include localized lasers or pulsed light therapy, which help to disrupt the inflammatory process. Here's my thing with that. Why is there an inflammatory process going on? Yes, we know that light switch has been turned all the way up, but what caused it? We know that light switch is always going to be turned on because it's genetics, but what caused it? And how do we bring it back down? That's what I do. We're not just figuring out how to disrupt the inflammatory response. We want to know what's causing it, find that trigger, stop the thing that's causing it, whether that be our hormones are off and we do need hormone replacement therapy, or there's a thyroid issue that we don't know about, all these different things that we could check to figure out where our body fluxed so much and swelled so much that our lymph nodes can't handle the amount of swelling that's there, and it's backing up and it's just sitting and stagnant and it's not working. So yes, those things do work, but why don't we actually work with the body's process of getting rid of inflammation and fix the problem, right? And figure out what caused the problem so that we can start better managing it, but also make sure that inflammation isn't going to come back or build up again. So pain management is also critical. The pain of HS is both inflammatory and non-inflammatory. Source of pain can include scarring, causing tensile pain, so being like you can't lift your arm because there's so much scar tissue. Keloids, which is that skin bubbling, folding hardness. Abscess, open ulcerations. So abscesses are the big nodules. Open ulcerations are actual like caverns in the skin that are open and broken skin. Sinus tracts, fractional pain, lymphedema, and fissures and arthritis. Depending on the disease severity and the type of pain, topical agents, lidocaine and anti-inflammatories, systemic anti-inflammatories, blah, 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 all the anti-things, gabapentin, all these medications could be beneficial. So one of the things they mention is lymphedema. Lymphedema is where a lymph node is not working, or there's no lymph node there because it's been excised or taken out, or it's damaged, or it's broken, or there's primary and secondary, right? So primary is when you're born with a lymphatic deficiency. So either you weren't born with enough lymph nodes, you were born with lymph nodes that were misshapen, something like that. So hypoplasia, hyperplasia, aplasia. Aplasia means you have none. Hyper means there's too many and they're all intertwined and not functioning properly. Hypo means that you didn't get born, geez. You weren't born with enough lymph parts to get this swelling out of your body 24/7 the way that the system's supposed to work. So when they're talking about lymphedema, lymphedema is a chronic swelling condition. Now, this doesn't have to be permanent. Lymphedema is another one of those things that is very miscommonly diagnosed. I am a lymphedema specialist, so this is something that I see a lot with HS, or I'll have clients that come in with lymphedema and have HS. They play off of each other, right? The chicken or the egg, which came first? A lot of times, HS comes first and then the lymphedema, because we have a lymph obstruction. We have so much swelling that it shut off the whole sump pump that's meant to pump all this out of you, and now you're backing up into your arm. So it's presenting as lymphedema. It doesn't mean that it's true lymphedema where it's going to be there forever, because if we get this clear, all of this can drain and it may not ever come back. But if it is truly genetic, it may come back. So this is why they say lymphedema. Regardless of the stage of the disease, treatment should include the management of comorbidities. Comorbidities just mean symptoms, and other things that are going on in the body that are being caused by this, like lymphedema, that contribute to the development of or worsening the disease process. Individuals above ideal weight or who smoke have severe disease progression, so counseling can help with weight loss and smoking, blah, 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 blah. Treatment also involves avoidance of skin trauma, obviously, because you're super swollen, avoiding tight clothes, synthetic clothing, harsh products, or cleaning tools, so loofahs, washcloths, brushes, because you could possibly rip the lesions and cause those fissures and those ulcerations. Avoiding adhesive dressings, soft dressings with clear petroleum jelly, or non-occlusive dressings, things like that can be used to prevent further irritation for the draining that's happening. I'm just going to skim through, there's a lot of things like different diagnoses, prognosis. This is a really long thing, so I'm trying to just get the pinpoints for you guys. So HS is a chronic inflammatory skin disorder with lesions ranging from deep-seated painful nodules to abscesses with sinus tract formation and dense fibronodular scarring. All that means is HS is an inflammatory condition. Your lymphatic system is responsible for getting rid of inflammation. If that's not happening, that inflammation will sit under the skin, and then eventually the pressure will be so much that it breaks the skin open and all the swelling comes pouring out. That is basically HS in a nutshell. The reason that you get the odor is from that constant leaking and the bacteria, the same way you would with lymphedema when the skin is leaking on the legs and you have weeping wounds that start to get really smelly. It's stagnant swelling that's breaking through, so it's been sitting there and becoming literally pH acidic in your body. Your body's like spitting acid fluid at this point. They can be deep-seated or just little lesions starting on the top, depending on how progressive it is. They say sometimes it begins with the obstruction of a hair follicle, followed by a rupture. It's both hereditary and environmental, strongly associated with external influences. Treatment includes medication, all the way ranging to steroids, hormones, and surgery. HS can cause significant psychological distress. We know this. I think that's pretty much it for the end of this article. Then they just show some pretty graphic pictures, which I chose the least gross ones to show you guys. Okay, this is the most important part, and I saved it for last because this is literally where everything comes full circle for us as far as understanding HS and how to stop the inflammation and reverse it and get rid of it. So, Complications include both physical and psychological conditions. Physically, reoccurrence of lesions leading to abscess tracts and scarring can cause chronic pain, limb contractures, and impaired mobility. Lymphatic obstruction can lead to peripheral lymphedema. Long-term effects of chronic inflammation can also occur, including anemia, hyperproteinemia, as well as axial and peripheral What? I can't even read that word. I'm sorry. Okay, basically what it's saying, arthropathy, but that's neither here nor there. So this whole thing is saying that the swelling is sitting on your lymph nodes and it can cause that lymphatic obstruction, causing that swelling. We're not just talking about it spreading though, in the area itself. So how does this start? It started with some sort of obstruction, ingrown hair they want to say, right? Or just swelling in the area. It's starting with that. Then it's obstructing the lymphatics from pumping. It's obstructing the lymph nodes, and it begins to present as chronic inflammation or peripheral lymphedema. Let's just take everything we just read, take all the fancy words out of it, and water this puppy down. Let me give you the timeline here from start to finish, okay? So we start with this little thing. We've got to bump a swelling thing, right? Your body is swelling. For whatever reason, that swelling's not being cleared out. And then over time, because you go to the doctor, they give you a steroid cream, it doesn't work. They give you cortisone injection, it doesn't work. You keep putting things into a highly absorbative area where lymph vessels directly are and is already swollen. And it's getting worse. And then maybe it gets a little better. And then maybe it gets worse. And then maybe it gets a little better than worse, but then it's maybe even worse. And it keeps building. Why? Because we're not moving that fluid. It's just piling on, and we're doing all these things and putting all this stuff here, and it's piling on. And none of that is functioning or pumping. So what was a tiny little pimple is now a big nodule. And then it grows and grows and grows, and it spreads. And here's the thing I want you guys to understand about this. It's not always nodules. Sometimes your whole armpit is just swollen, like really bad and really heavy. But because it's not red or hot, you think, oh, it's okay. I don't know, it's just sore. I don't know why it just feels sore and it's swollen. Because you're having a lymphatic blockage or a buildup, and we're not addressing it. And then it starts to become lesions and pooling and breaking open and big flaps of skin that are really swollen. It started as a lymphatic obstruction and a problem. Let's say it did start with an ingrown hair that became a lesion. What do they say? Hair follicles, obstructed hair follicles. That isn't just like body oil obstructing the hair follicle. The hair follicle, just like an ingrown hair, is swollen. And then that swelling just piles up because what's meant to happen is your lymph nodes are meant to pump, suck that swelling back away from the hair follicle, and you pee it out before it sits there stagnant and becomes a problem. And with HS, it's sitting there stagnant and becoming a problem. So let's say it did start with a hair follicle. It's now the whole area that's really swollen. And now we have flaps of skin that are swollen. We have nodules that are swollen. We're not addressing the underlying layer of stagnant swamp water that's building up in that area. We're trying to treat it topically when it's an underneath problem. And then, as it says, lymphatic obstruction, it begins to obstruct everything. And then all your other lymphatic pathways, like on that map I showed you, start to break out. So when we're talking about the spread of HS, it's not like a creepy crawly spread. It's like it pops up. So it'll pop up here, and then it'll start to pop up here, and then it'll start to pop up here, and then down here, and then into the pubic region, and then under the glutes, and then under here. It's not like a bacteria where it spreads. It's literally your lymphatic system being blocked up, and that swelling is like pushing up against the surface of your skin, and it can't move. So it's going to all these other lymphatic chains. So it may start here, right? But since the fluid can't get here, these are your lymphatic highways. These are your pathways as to how your body drains. So it's going to try to go this way to get to the other side. And then it gets here, and then it's swollen, and then you get the breakouts and the lesions, and then it's this side too, and the breakouts and the lesions, because for whatever reason, which we find out once we do the 5-day clean out with you guys, and I see you for 5 sessions, either twice a week or more than twice a week, but we dig through your entire health history, when it happened, when it started, all your lymphatic history. I ask you a million questions about your health history, and then the second day we go into diet and food allergies, because a lot of times there are food allergies associated with this. Whatever's producing an inflammatory response in your body will cause this because your lymphatic system is not pumping properly. So as this fluid, that's just normal fluid with proteins and keratins and white blood cells and fats and all of these things that you see leaking out of there, right, that create like the pustules, and your body's trying to process out those macromolecules, and it can't. It's not working. So it starts to try a different way, and it can't, and it's not working. So it builds up and it starts to create lesions. And then down here, it's trying to take on all the fluid from up here. So it builds up and it becomes lesions. So a lot of times, everybody's super amazed that when they look at this map and they look at where their HS is, it's right in the lymphatic pathways, right in those drainage pathways, because your body is still trying to do its job. But for whatever reason, something's standing in its way, or something keeps creating all of this swelling and inflammation in your body. Your lymphatic system doesn't create swelling. Your lymphatic system gets rid. It's a one-way system. So if we're having this buildup and blockage, it's because that system isn't going the one way it's supposed to, and it's getting stuck somewhere. And then we have this breakout of fluid and draining and odor and like swamp water with these proteins and all of this stuff in it. And then, like they said, when they test that fluid, it's sterile. It's lymph fluid, but it's breaking out of your body. And then from it sitting there and the moisture, that's when the bacteria happens. So treating HS, obviously smoking is a no-go. Obviously, weight is something we need to be cautious of, right? But a lot of times, you guys will work out like crazy. You'll try going vegan. Going vegan, I will tell you, pro tip, will make it worse in a lot of cases. Not everyone, but in a lot of cases, going vegan will worsen your HS, and it doesn't go back down because it causes, based on what? This is just something I've seen. This is not your case directly. I'm not giving you medical advice, none of that. But what happens is your body has allergies to certain things you don't know about. Let's say, like one of my clients, nightshades, tomatoes, eggplants, potatoes, things like that. And you start eating more of that regularly, your body starts to inflame. It's a histamine response. It's reacting. So that builds, and the one system that's meant to take that inflammation out is not working. So it builds and then it stays. And this is the thing with HS flare-ups. A lot of times over the years, because you guys don't know what to do about it and it's not getting any help as far as coming down, with those lesions, that HS flare-up, it'll build and never go down. It'll come down a little bit, but it won't ever go back to the way it was before. And it'll build again and again and again and again. And this is how scar tissue builds up, because we're just piling on the swelling into a system that isn't taking anything out. It's just sitting there and piling up, becoming swamp water. So anytime you have a swelling incident, so like they said before, being out in the heat, having an inflammatory response, getting sick, having an allergy response, all those things, menstruation, things that naturally cause your body to swell, things happen and your body swells in response. Your lymphatic system is responsible for taking down that swelling and filtering it out. But that's not happening. So a lot of times with HS, you'll have a flare-up, but it won't go back down. It'll just stay the same. You won't see anything come down, no matter what steroids or anything you're using, because it's a content problem. We have too much volume. So there is dynamic insufficiency and mechanical insufficiency of the lymphatic system. Dynamic insufficiency is more of a volume problem. There's too much volume for your lymph system to take down. It's not able to get rid of it by itself because it's such a tiny system, and that swelling is so big and so thick, and a lot of times it's not just water, it's those proteins that are building up in there. Your system can't absorb it at the rate that it's pumping normally. So doing manual lymphatic drainage gets your system boosted 10 times the speed to start taking that volume down so it can kick on by itself and continue draining by itself. The mechanical insufficiency is something where, like, if we have cancer and we get lymph nodes removed, we no longer have that part. And that's why lymphedema is a chronic condition, because we're now down a bunch of lymph nodes. That part isn't there to drain this anymore. So we constantly have to support it. We constantly have to drain it. We're missing parts. Think about a sump pump, right? If we break a couple parts off that sump pump, but keep it plugged in, yeah, it'll still pump, but it's going to be spitting a lot of water because we're missing, like, we cut it in half. We took off half the sump pump. So that's more of the mechanical insufficiency. Dynamic is, think about a sump pump, drop it at the bottom of the ocean and expect it to pump the water out from the bottom of the ocean to the surface. It can't. There's too much pressure on the system. So manual lymphatic drainage is decongestive therapy. We are decongesting the tissue, decongesting the body, decongesting the skin. And HS is an inflammatory congestive problem of the skin. And leaving it there, it becomes that fibrotic, hard, thick lesion, scar tissue situation that we saw. So, to wrap this up, HS is a chronic inflammatory condition of the skin. Hidradenitis suppurativa is the fancy name for it, HS. It can go from looking like a little ingrown hair to giant nodules under the skin and break out into lesions or ulcers with big swollen skin folds. It happens where you have glands. So armpits, hips, pubic area, glutes, buttocks region, under the breasts, where you have glands. Think about where you sweat, behind the ears, behind the neck, areas like that. It is not a bacterial infection. It is a swelling inflammation problem that can be genetic. So it can become a bacterial infection on the outside. But when they test the fluid, it's sterile. It's just a swelling issue in the area. And whether it be genetics, hormonal, or some other thing, it is a swelling issue. It's an inflammation issue. HS is an autoimmune. And as we know with all autoimmunes, they are all inflammation. And they are all the same way as far as the inflammation and the flare-ups and the triggers. We need to figure out what your triggers are. So I work with HS patients virtually as well as in person in New Jersey. So if you are virtual, call the office, 732-841-0142, and we can set up a virtual and see what's going on with you, talk about your health history, take you through the whole 5-day protocol, 5-session protocol. But the lymphatic drainage part of it, where we are manually dilating the lymph system that's already in these areas that the HS is sitting on top of, to absorb and drain the area back into your body so you pee out all of those proteins, all of that excess swelling, all of that stuff. That manual lymphatic drainage technique, we can help find someone for you to get that done, to start draining this out and clearing it up if it's even necessary. A lot of times, once we start taking care of our body lymphatically, it starts kicking on. So there are lots of things for HS virtually that I can do to help you guys. Lots of techniques and stuff that I can teach you, lots of tools that you can use, tons of stuff. We have a whole protocol for HS. But if you're in New Jersey, call the office, 732-841-0142, and I can see you guys and actually work on you, as well as taking you through the 5-session protocol, cleaning you out, getting your full story, figuring out what's going on, where your triggers are, things like that. Because a lot of people look at HS as just like a topical situation because it's erupting and they want to do wound care and that's it. But guys, if you have fabric and all of that pressure is behind the fabric pushing forward, the ends of that fabric isn't going to close very well because it's really swollen. When that fabric is laying flat next to each other and you go to sew it closed, it closes seamlessly and strong. It's the same thing with healing these lesions and these skin folds and this fibrosis after HS. We use the MRI lipofoams for that fibrosis to get it to soften and turn back to its natural fluid state so that it can be reabsorbed back into the body and peed out. So we can deal with the fibrotic part and that hard part and the keloid part of the HS as well. So if you're in New Jersey, come in to see me. If you're not in New Jersey and you still want my help with HS, set up a virtual with me. Call the office and we'll be able to get that set up. Because guys, this is just a really, really, really bad lymphatic dynamic pressure problem happening in the lymph node regions. It's directly in those lymph node areas. So we can absolutely help get that to drain and get all of that down, and then figure out where your triggers are and what keeps causing it lymphatically, what your lymphatic triggers are, and how to support your body and balance those triggers so that you don't have to live with these lesions and this pressure and the odor and the problem all the time. So that is my rant on Hidradenitis Suppurativa HS. If you guys need me, you know where to find me. This video will go up on our YouTube, as well as the snippet on our Instagram and our TikTok. It'll also go up on the podcast. And I do all kinds of autoimmune conditions, guys. Like I listed before, I do all the autoimmune conditions because they're all the same. They're all chronic inflammatory. And that inflammatory, your lymphatic system is supposed to take care of that, and it's not. We need to figure out why, and we need to treat the lymphatic system to get rid of all of that stuff, all of that buildup that's happening sitting in your lymphatic system. So guys, I really hope you enjoy this. The article it's literally called Hidradenitis Suppurativa, and it's National Library of Medicine. That's it. And you will, I know you're listening to me, but you will see the spelling for that in the title as well as in the caption. So guys, if you have autoimmunes and you need me, or you have acne inversus or HS or inverse acne, give the office a call. You know how to find me. I hope this was helpful. I hope this was educational. And I will see you guys soon. Ashley with Amare. Bye.